The Health Ministry received the COVID-19 rapid antigen test kits on Wednesday, which will be rolled out to all major hospitals soon. This was confirmed by Health Minister Terrence Deyalsingh, who said the rapid tests will be conducted at 5 sites within the next week. Sunalala covered the ministry's COVID-19 update on Saturday and filed this report.
In August, Health Minister Terrence Deyalsingh dubbed these rapid antigen test kits as a game changer and said government ordered 168,000 kits at just under $1 million. At the Health Ministry's media conference on Saturday, he said 2 types of kits have arrived, Standard Q and Standard F.
We have received 150,000 of those to be distributed eventually amongst all our hospitals and some community settings. And another one called Standard Q, we have received 40,000 of those. Those have a lower degree of accuracy.
The cost for these test kits are relatively cheap, just US $6 each, as opposed to US $100 each for the PCR test kits, and they have a much quicker turnaround time of 30 minutes. And despite this test being introduced into the system, Principal Medical Officer of Epidemiology Dr. Naresh Nandram said this will be used as a screening tool and will not replace the PCR tests.
Moving this point-of-care testing into the accident emergency departments will enable the doctors and the nurses and the healthcare staff there to determine very quickly if that person sitting in front of them happens to have COVID-19 and then action, based on that result.
He explained that the Standard F test involves placing a cartridge into the machine to determine the result, while the Standard Q test is similar to that of a pregnancy test, which shows the results via lines. The rapid test will undergo a trial period where it will be validated using CARPHA's validation system to ensure results are accurate.
Once a sample is taken and run on the antigen testing, that sample will also be run using the gold standard PCR, just to ensure that we can trust the test.
And at least one person has already been tested via these new kits.
Patient 1 for this antigen testing was myself yesterday. We used me as a guinea pig yesterday, so I am guinea pig number 1, and my test came back as expected, negative.
The rapid antigen test will be rolled out at all major hospitals in Phase 1 and then to all health facilities in Phase 2. Sonolala, TTT News.